I'm Darcy Wooten. I'm the Program Director for the ID Fellowship at Washington University, and it's my immense honor to introduce Dr. Elvin Geng, who is a professor of medicine in the Division of Infectious Diseases at Washington University in St. Louis, where he also serves as the Director for the Center for AIDS Research, or CFAR. Welcome, Elvin. Thanks so much for taking the time to talk with me today.
Thank you.
We're going to dive into a lot of details about the CFAR, but before we do that, Elvin, I was thinking you could tell us a little bit about yourself, the work that you do, and really kind of what motivates and drives you to do such critical work.
I grew up in California. I did my training in New York and in California, and stayed in California for a number of years before coming to WashU in Missouri in 2019. And it's been a great move, and I've really loved being here in St. Louis. I'm passionate about infectious diseases and about HIV for many different reasons, but one of the reasons that I do what I do is because in this branch of medicine, we have a lot of really effective treatments for people, whether they're antibiotics or antiretroviral therapy. We can help mitigate the suffering and improve the lives of people who have these conditions. And so the task at hand is to make sure that we advance the science, continue to improve those things, as well as make those things available to people in a way that's accessible, that's friendly, and that is aligned with what they want to do in their lives. And so I'm inspired by the good that we can do, as well as oftentimes motivated by the ways in which we sometimes fall short. So there's work to be done. It's good work, and I'm glad to have a chance to do it. Sometimes people ask me how I got interested in HIV. So I went to medical school in the late 90s, which tells you a little bit about maybe how old I am. But at the time, I was in New York City, and many new treatments were coming out for HIV. So in the New England Journal, there would be articles about some combination of antiretrovirals. But at the same time, in the mid-90s, 1 out of 4 beds in New York City were people with HIV. And many people were severely ill and even dying of AIDS. And I thought, since we have these medicines, we have to do everything we can as a profession and as a field to make sure that people, even people who are marginally housed, who are using drugs, who have mental illnesses, can also benefit and use these medications. So that's how I became interested and inspired to work on HIV.
That's amazing, and I think that really resonates with a lot of us in infectious diseases and explains sort of why we do what we do and get up in the morning. I want to kind of switch gears and dive into hearing a little bit about an overview of the CFAR and kind of what its mission is and what it focuses on.
So the Center for AIDS Research is, by way of background, a network of centers that are funded by the NIH across the United States. And there are approximately 20 of these centers. At WashU and in St. Louis, we have not previously had a CFAR, and so we are joining the CFAR network, WashU, SLU, and Harris-Stowe as a consortia. So what does the CFAR do for us? It's a series of activities that we have proposed to the NIH that we would do to help the science-based HIV response in the region. From a research point of view, that means we will create resources for researchers to carry out HIV-related research. So that includes simple things like creating a seminar series, but also things like consultations from more experienced investigators to junior investigators who are looking to develop scientific ideas. We have this mechanism that we call a studio, where when people have an idea, we convene a group of people to help you grow and develop that idea.
Wow.
So you can sort of talk about it with people in a structured way, and people who have different expertise in different areas, so you can kind of cultivate the idea and turn it into a proposal. Because NIH funding is hard to get, we also fund pilot awards. So a lot of times, if you have an idea that you're growing, you might not be completely ready to apply for an NIH grant, but you can get a pilot award, get preliminary data, and strengthen your ability to apply for a grant. And we have a lot of senior investigators that are very committed to helping grow the research community. Juliet Willimore, who's a PhD and also a part of our division here in infectious diseases, does community-based research. And she's also an excellent speaker about the process of grant writing. And she takes a very positive lens on it. A lot of people are scared of grant writing. To her, she talks about grant writing as a way of dreaming, of coming up with of inspiration and ideation so that you can think about what the world needs and propose it. And sometimes you get a chance to carry it out too. So all of those things are supposed to help us build a research community. Good knowledge generation, good research isn't just done within the sort of four walls of the university. And so we also have a lot of activities that try to connect the university community with the wider community, with the public health departments, with community-based organizations, with other universities, all of whom have an interest in who are working on HIV, so we can do things together and we can do things in synergy. There's this concept called collective impact, which is the idea that in any complex situation, there's lots of different groups and people working towards a similar goal, but not always fully aware of each other. And one of the things that we hope the C-FAR can do is to help us connect the dots between everybody so that the sum is sort of greater than the parts.
That's amazing. I love how much interconnectivity there is and how much integration, not only within sort of the walls of academia, but really taking and using and optimizing a community-based approach as well. It's absolutely what you need. I want to talk about the future. I work with a lot of ID fellows, early learners, people who are early in their career. Let's say that I'm early in my career, either an ID fellow, postdoc, early career faculty. How might I get engaged with the C-FAR, and kind of what things would the C-FAR be able to do to sort of help me as I'm beginning this career?
You may enter fellowship or your postdoc, and you may have an interest in HIV-related research. You may not know everything that you feel like you need to know about it, but we would hopefully have things that could help you at each step of your journey. So as you're sort of thinking about and exploring, we would have things like seminar series. We would have things like what we're calling HIV translational grand rounds, and other things to expose people so that they can begin to think about, is this aligned with my interests? We also have social events so that there's a community of people that you can connect to who would be able to tell you more. So let's say you have taken that first step, you're interested, you want to learn more, or you have an idea that you want to think more seriously about. There's lots of logistics, there's lots of questions. The center provides consultations, so you can reach out, whether you're a basic scientist, a clinical researcher, or an implementation researcher. There are experts that you can reach out to that we will provide, that will do face-to-face discussion and consultation with you to develop your idea. And also to tell you about the other resources that might be available, and to think with you about other ideas that might intersect with yours. Some other things in this space, we talked about studios. We can convene a group of people that have similar interests that you may know already, but you may not know, who can help work together with you to sort of shape up an idea. And I think one of the things about the C-FAR network that also helps people grow is, particularly when you're a junior investigator or an emerging faculty, there's WashU, but there's many, many universities out there and many, many departments of health and things like that. And the C-FAR network is quite strong. So we have events. We had a meeting in New York a couple of weeks ago where we were able to bring some of our junior investigators, and they could meet other people like them from other universities across the country, as well as network with other people in that environment. And because the way that science is organized, those meetings, those chances to kind of discuss science, but also have dinner together and things like that, many times will lead to connections and networks outside of the university here across the country that will help you in the future. So I think all of those things are things that can help people grow in their scientific journey.
That's amazing. It sounds like there's a really strong community of practice and so many different layers of mentorship, which we know is so critical for the success of everybody.
Yeah.
I wanted to circle back to one thing you mentioned earlier, which was implementation and dissemination science. And I know that's a piece of the C-FAR. And I think that's an area that's maybe less familiar to some of those up and coming trainees, but I think is really exciting. And I was wondering if you could tell us a little bit about what that is and what the potential is for implementation and dissemination science within the C-FAR.
Implementation science is kind of a newer a thing. I think it's increasingly known about, but I think a lot of people still have questions about it. It happens to be one of the real strengths here at WashU, even outside of the sort of HIV or infectious diseases research community. Implementation science in general is something that WashU is a leader in. And I think for many years, particularly in health and healthcare, we thought about developing medications or diagnostics or understanding the biology of things, the pathophysiology of things as the science. And once the science produced treatments or vaccines or other things, that we had done our jobs. And therefore, the rest of the society could figure out how to get this out into public use. And I think over time, what researchers have realized is that that's only the first step of the journey. So once we've produced these things, do people actually benefit from them? Do people actually use them? And is society becoming healthier and stronger for these things? Is actually harder than it might first appear. So implementation science is an interdisciplinary set of perspectives that turns a scientific lens to the implementation process and asks questions like, what are the kinds of things that we can do at an organizational level, at a community level, at a systems level, as well as at an individual provider and patient level to ensure that the treatments that we have are accessible, are appropriate, are aligned with the sort of what people want, and are therefore taken up and used in a sustainable way. As we all know, we've just recently gone through a global respiratory viral pandemic, and we developed a vaccine to this in an incredibly short amount of time. And about a year after the vaccines were first widely available, the NIH director was interviewed on 60 Minutes, and he said never did he imagine that a year after the vaccine had been developed and made available, that only 2/3 of Americans would have received a vaccine for COVID. And I think that in implementation research, we recognize that challenge is not just a challenge for vaccines, it's a challenge for almost every product for health that we have. And that we need to think scientifically about that gap and try as best as we can to close it in a way that's equitable, sustainable, and which improves the health of the public.
And I think as a clinician, I see that every single day and sort of how can we close these gaps. So I think it's really important work and really exciting work as well. I know we're just about at time, but wanted to see if there's any last thoughts that you wanted to give us about the C-FAR, about training in infectious diseases and HIV, anything else.
It's an exciting time to be a part of the science-based HIV response. 30 years ago, in many ways, the HIV epidemic garnered more attention because there was more fear around it and more stigma. But over time, we have developed a lot of really effective treatments, and I think overall, we're in a much better place. HIV has receded from the public imagination, and so in some ways there's less interest in it, but it is a very special time in this science-based response because we have an opportunity to sort of get across the finish line, so to speak. We have really good interventions. We have really good prevention interventions. And that means that the distance between where we are and making sure that all people living with HIV benefit optimally from the treatments that we have, and people who are not living with HIV benefit from the preventative interventions we have, is something that we can achieve in our lifetimes. And it's a special time to be a part of that, I think, response.
Wonderful. Well, thank you so much for taking the time. It's been absolutely inspirational talking with you. And thank you so much for all of the work that you're doing.
Thank you.